Good day, everyone. I'm Jovis Satoheto, caregiver of Sasin Iloilo Batch 3, and today I will be performing nasogastric tube insertion method of introducing a tube through nose into the stomach. The purpose of NGT to feed client with finish when oral intake is not possible, to dilute and remove consumed poison, to instill ice-cold solution to control gastric bleeding, to prevent stress on operated site by decompressing stomach of secretions and gas, to relieve vomiting and distension, inserting of nasal gastric tube, check the doctor's order for insertion of nasal gastric tube. This clarifies procedure and type of equipment required. Explanation facilitates client's cooperation. Organization provides accurate skill performance. Removal and nasal gastric tube. Assemble the appropriate equipment such as kidney tray, tissues, or disposable gloves at the client's bedside. I will lock the door. Fix the curtains for the patient's privacy, and perform hand hygiene to prevent microorganisms and infections.
Our equipments, we have here a nasogastric tube, a glass of water, a lubricant gel, scissor, tape measuring, plaster, pen light, syringe, and assuming that this is the pH strip.
I will introduce myself to my patient using two identifiers and explain the procedure. Good morning, ma'am. I'm Jovi Satoheto, your healthcare provider for today. May I see your wristband, please? May I know your name, ma'am? Your birthday? Okay, thank you. Assist the patient into the sitting position. I'm here today. We need to insert the nasogastric tube. This tube will be inserted from your nose down to your stomach, and that is where your food will pass through. Place the disposable towel into the patient's chest. Measure the desired length of the nasogastric tube to be inserted. Tip of the nose down to the earlobe. Tip of the nose into the earlobe. Then measure to 5 cm below the cyphisternum. Note the insertion length. Lubricate the tip of the nasogastric tube. So, I'm gonna put the tubing now. It's gonna be uncomfortable if take small tip of water while transferring the tube. Okay, gently insert the nasogastric tube into the nostril. Advance the nasogastric tube until you reach the desired length of insertion. Inspect the patient's mouth to ensure the nasogastric tube isn't coiling. Insert the nasogastric tube. Attempt to aspirate gastric contents. And make sure to close the nasogastric tube port. Gather all equipments. So, ma'am, I'm done with your nasogastric insertion. Again, thank you for your cooperation. And don't forget to wash your hand after the procedure. To complete the procedure, I will document the time and date of my procedure, inform the nursing staff not to use the nasogastric tube until safe placement is confirmed.